comes to reversing type 2 diabetes, there's one word that seems to dominate the conversation, which is weight. But let me ask you something. How does that word make you feel? For so many people, the idea of weight loss feels overwhelming, frustrating, and even impossible. And I understand why, because for years we've been told that losing weight is the only way to improve our health. But no one ever talks about how to do it in a way that's realistic, sustainable, and most importantly, achievable. But here's the thing, while weight loss can be incredibly powerful, it isn't actually the only factor that matters. And this is where I get really excited about the science, because studies now show that you can improve your blood sugar levels even without weight loss. That's right, your blood glucose level can improve through changes to your diet alone, regardless of what the scale says. And this is one of the reasons I'm such a strong advocate for using therapeutic carbohydrate restriction or a low-carb diet as a method to reverse diabetes. In fact, in my own clinic, I've observed this time and time again. When people adopt a low-carb approach, their blood sugar levels often start to improve before they see any significant changes in their weight. And most often what happens is that both do occur together. Blood sugar comes down and the weight loss follows. So today I want to talk about the role of weight loss in reversing diabetes, why it matters, how much weight you actually need to lose to see results, and most importantly, why it's not the only path to success. I'll also share some practical tips for approaching weight loss in a way that feels more manageable and more empowering instead of, well, overwhelmed. And before we dive in, let me introduce myself. I'm Dr. Nerys Frater. I'm an NHS GP and founder of the Lifestyle Clinic. Over the years, I've worked with hundreds of people who've reversed their diabetes, and I've seen firsthand how even small amounts of weight loss, or even no weight loss at all sometimes, can lead to dramatic improvements in health. So if you've ever felt like weight loss is out of reach or like it's too late to make a change, I want you to know this: it's never too late, and you don't have to do it alone. So let's start with a big question. Why does weight loss matter when it comes to reversing type 2 diabetes? And the answer lies in something called visceral fat. This is the fat that surrounds your organs, particularly in your abdomen. It's not the fat you can pinch in your arm. It's deeper inside your body. And here's the problem. Visceral fat plays a major role in insulin resistance, which is the root cause of type 2 diabetes. When you've got too much visceral fat, it interferes with your body's metabolic pathways. It interrupts hormones, for example insulin, from working properly. And this puts pressure on your pancreas, causing it to have to work overtime. And over a period of time, this leads to high blood sugars and other complications that we would associate with diabetes. But here's the good news. Even a small amount of weight loss can significantly reduce visceral fat. Studies have shown that losing 5 to 10% of your body weight can dramatically improve insulin sensitivity and decrease those blood sugars. So let me break that down for you. If you weigh 80 kilograms, losing just 4 to 8 kilograms, so about 9 to 18 pounds, can make a measurable difference to your health. You don't have to lose half your body weight or aim for an unrealistic goal to see results. Every little bit counts. And it's not just about blood sugar. Losing visceral fat also reduces your risk of other complications like heart disease, high blood pressure, and fatty liver. It's like a ripple effect. When you start improving one area of your health, it has a positive impact on everything else. You have a lot to gain. But here's where it gets even more interesting. While weight loss certainly is the most powerful way to improve blood sugar levels, it is not the only way. So let's talk about that therapeutic carbohydrate restriction, or what many people know as a low-carb or ketogenic diet. This approach focuses on reducing the amount of carbohydrates you eat, which lowers the amount of sugar entering your bloodstream. And here's what's fascinating, is that studies have shown that this method can improve blood sugar levels independently of weight loss. So think about that for a moment. Even if the scale doesn't budge, your blood sugar can still improve. And this is because a low-carb diet directly addresses the root cause of type 2 diabetes, that insulin resistance. By reducing the amount of sugar your body has to process, you're giving your pancreas a much needed break and allowing your cells to become more sensitive to insulin once again. So in my own clinic, I've seen this play out time and time again. When patients adopt a low-carb diet, their blood sugar levels often start to improve within weeks, sometimes even days, before they notice any significant change in their weight. And most often what happens is that both occur together. Blood sugar comes first and the weight loss follows as your body adjusts to this new way of eating. And this is just one of the reasons I love using carbohydrates restriction as a tool for reversing diabetes. It's not about deprivation or quick fixes, it's about giving your body what it needs to heal. And the best part is it's sustainable. I've been living this way for over 7 years now. You're not starving yourself or following any extreme diet. You're simply making smarter choices about the foods you eat and how they impact your body. So if you've ever felt discouraged by the idea of weight loss, I want you to remember this. You don't have to focus on losing weight to start seeing improvements in your health. And when you focus on improving your blood sugar as a priority, weight loss often becomes a natural byproduct of those changes. So it's worth considering that maybe shifting your focus to helping your pancreas work better might actually be more beneficial for you, because setting weight loss goals for the majority of people make them stressed and overwhelmed because it's linked to so many negative beliefs, memories and patterns. So I want you to take a moment to think about the emotional side of weight loss, because let's be honest, this isn't about numbers on the scale, is it? For many people, their weight is tied to feelings of shame, frustration, guilt or failure. But it really is not your fault. We live in a world that promotes quick fixes and extreme diets. And it's easy to feel like you're doing something wrong if you're not seeing results straight away. But I really want to share something important with you. Your worth is not defined by your weight. This journey isn't about punishing yourself or trying to fit into somebody else's idea of what you should look like. It's about taking care of your body and your health in a way that would feel good for you. My specific aim is to get your pancreas working better. I'm less interested in the actual number on the scales or how you look. And I know that's easy for me to say, but it is why I always encourage my patients to focus on progress and not perfection, instead of fixating on the scales and letting that govern your moods and emotions. I want people to focus on those small wins, having more energy, sleeping better, feeling more confident. These are the things that actually really matter, and they're what will keep you going in the long term. So if you've ever felt like weight loss is an impossible mountain to climb, I want you to know this: you don't have to do it all at once. All right, so let's get practical. How can you approach weight loss in a way that feels sustainable and achievable? Well, here's a few strategies that I've seen work time and time again for my patients. Number one is to start small. Focus on one habit at a time. Play the long game. Number two, a low-carb focus. So prioritize blood sugar improvements first. And number three, daily movement. Walk after meals because it decreases your blood glucose, as well as the other health benefits of walking. And number four, the one I find most challenging, is to plan your meals. Make sure they're low carb, nutrient dense, and just plan before. Number five then is self-compassion. Celebrate your progress, not perfection. So, as we've seen, the role of weight loss in reversing diabetes is powerful, but it's not the only path. So whether it's through consistent, small changes to your lifestyle, focus on your blood sugar with a low carb approach. What matters most is that you believe it's possible, because here's the truth. Your health is not fixed. It's not set in stone. And no matter where you're starting from, your body has an incredible ability to heal when you give it the right tools. Change won't happen overnight, but it does happen one choice at a time. Thank you for sharing this time with me today. I hope you've left this video feeling inspired, hopeful, and ready to take on the next step in your journey, whatever that may look like for you. And remember, there's still time to sign up for our upcoming free webinar with me. So the details are below. Take a look and I'll see you there.